Hello everyone. Thank you for joining us today. Hi, my name's Tracey, my pronouns are they, them, and I am the Digital Delivery Coordinator for Sexual Health at LGBT Foundation. So welcome to this amazing webinar on PrEP. So super excited to be here. We're going to give it a couple of minutes, see if we can get any more people in the chat, and then we'll get started. Hi Craig. Hi Meg, how's it going? This video will be available online afterwards as well. We will probably come with a edited version that will go to our socials as well. Try and give you that short form content on different platforms too. Okay, so I think we're going to get started then. So we're here today. It is PrEP Awareness Week. started on the 10th of March, all the way through to Friday on the 14th. And our slogan for this year is the power to prevent. This is held in partnership with the PaSH Partnership. The PaSH Partnership are a combination of BHA for Equality, LGBT Foundation, and George House Trust. Excellent, thank you very much. So what we do as a partnership, we host stalls and one-to-one interventions with our respective communities. So, for example, with LGBT Foundation, we deal with anyone of the in LGBT plus community, and supporting them in getting testing, getting protection, and general sexual health. We do group work and interventions. We work with a variety of different community groups. We do full screening and point of care testing, so sexual health testing and rapid HIV tests. We offer free condom and lube distribution. That is both in our wonderful Manchester Gay Village. We also offer that to sex on premises venues, and we also do a at-home distribution service as well, all for free. We offer our website and resources, so all the information that you might need to know about today is all available on our website. And we also offer a variety of different counselling and talking therapy options through all three of the organisations, BHA, George House Trust, and ourselves at LGBT Foundation. The links down below, you'll be able to find all the information, more up-to-date information as well, so that this video stays relevant. Okay, so first off, we're going to talk a little bit about what HIV is, and why we need to have PrEP Awareness Week in the first place. So HIV allows us is when we're talking about PrEP is an important way of reducing the risk of acquiring HIV. So HIV stands for Human Immunodeficiency Virus. It's passed through a variety of different methods, so blood, semen, vaginal fluids, anal mucus, and breast milk as well. It can weaken the immune system, so if it's left untreated, it can deteriorate your immune system to the point where it develops into a more severe condition, and it is lifelong, but it is a manageable condition now. So a little bit of numbers. HIV is acquired through a variety of different methods. You'll find here the statistics show it can be received in anal, and it can be received in vaginal intercourse as well, oral sex, blood transfusion, needle stick injury, and even as little as a human bite. But that is something that the risks reduce with each different one. So it's good to know what your risks are when engaging in any sort of sexual contact. But what is PrEP? So PrEP is a medication that you can take that will prevent you from acquiring HIV. Now, they come in a little box like this, and you have a supply for a month in a bottle. So they are taken either before sexual contact, or they are continued through periods of sexual activity. So we recommend on a daily basis, and we're going to get into that dosage just a little bit later. Clinical trials show that it is 86 to 92% effective, and it is currently prescribed to at-risk groups, but it is available for everyone. So regardless of your gender, sexuality, or sex, you are able to get on PrEP if you consider yourself to be at high risk. So it's made up of the same medications that treat HIV, but it's slightly different. The medication called Truvada, but it's got a variety of different names, as you can see here, but they all are called PrEP. So pre-exposure, prophylaxis, PrEP. Good things to know. It is free on the NHS. You can talk to any one of the team. So us at LGBT Foundation, George House Trust, or BHA for Equality, we'll happily talk you through it. There are a couple of different dosing options, and we're going to go through that shortly. It's important to have regular monitoring, and that does include your renal function. So it can affect the kidneys. So we do have regular kidney function tests, renal function tests that are done alongside being on PrEP. There are some side effects, things like gastrointestinal side effects. So you might have a bit of an upset stomach, you might have some digestion issues, but those do pass in time. It's always good to monitor your side effects, and if they do become difficult, speak to your healthcare professional and see about how you can negate those symptoms. It does not prevent STIs or pregnancy, so it's important to maintain protection as you are using PrEP. So you may be reducing your risk for HIV, but you're not reducing your risk of pregnancy or sexually transmitted infections such as chlamydia and gonorrhea. Dosing options. So it's important to know how to take your PrEP. It's not just a case of take it once and you're done. This is an ongoing medication. So we have two options. We have daily dosing and you have event-based dosing. So for daily dosing, you need a 7-day lead-in with this. So you take your medication for 7 days before you are covered, and take 7 days to stop after your medication stop. You've had that interaction. Daily dosing is for everyone. It is the best method to maintain that regularity with your own sexual health. It's as simple as putting an alarm on your phone and taking it when you've, whether you put it next to your toothbrush, take it when you brush your teeth, have it next to your kettle so that in the morning when you're having a cup of tea, you've got it there. So it's something that you've got for every day. Set a reminder on your phone, set a reminder with your alarms, and just make sure that you're taking that on a daily basis. It's good for any types of sexual activity, any type of person, and if you are using any injectable drugs, it is also good coverage for support with that, with daily dosing. Event-based dosing, people may take event-based dosing if they are attending events such as, you've got local events in Manchester such as Riot Party and things like that, where you have sex on premises events and you know that you're going to be having sexual activity during that time. It's a great option if you just want to take it for a short period of time. There are some issues with the side effects because you're starting and stopping. So we personally recommend daily dosing as the best method for protecting yourself, regardless of your sex, gender, or sexuality. So in terms of event-based dosing, there's a couple of ways you can look at it. If you were going to have sex on Friday, you would have to take a double dose on the Thursday, take your dose on the Friday, and Saturday and Sunday. That's for one instance of sexual activity. So you'd have to make sure that you take your doses for the Friday, Saturday, Sunday after you've taken that first double dose. If you were, so first 2 pills, 2.5 pills, 24 hours before sex. Then dose daily for 2 sex-free days. So you would have to limit yourself on your sexual activity, unprotected sexual activity during that time. If you were going to be going the whole weekend, so Friday, Saturday night at an event, same instance, you would take your 2 pills initially the day before. You would take your daily pills there, but then you would have to continue on 2 days after on a daily basis. So daily dosing for 2 days after the sexual intercourse. The guidelines are always changing. It's always good to keep up to date. So we have our information available here from PaSH. They have all the published information. However, I do also have our information on all the websites that you can see down below there. You can see on Greater Manchester PaSH, LGBT Foundation, and BHA, we all have our own pages on PrEP and how event-based dosing the restrictions are changing and how the guidelines are changing. So short lead in, if you were taking your daily double dose at the beginning on the Wednesday, if you're having sex on the Thursday, then you need to make sure you're taking 2.5 pills 24 hours before. So that would be making sure that you're doing your double dose initially and then daily dosing after. You've got your 7 days of sex free afterwards, and that would mean that you are covered for that one instance. But that is your short lead in time. So, a little bit about PrEP's history, overcoming stigma. PrEP's been available for a while now. It's been available since 2020. Free on the NHS at least. There have been instances where there are private companies that have been able to offer PrEP previously, but now we have it on the NHS. It's so much easier to get hold of. Some may notice the difference between the two images. So on the left, you've got when the contraceptive pill came out, and the pictures where they went riot with the sex positive medication that was being offered to people. The same wording, the same messaging tends to get used for PrEP as well. It's a lack of morals, a lack of values, and it portrays an image of promiscuity and shame on anyone who is taking this medication. But there is nothing shameful about looking after your own sexual health. It's important to be mindful when you're watching the media, when you're reading the articles, understand where their point of view is coming from. If it's a more restrictive, less sex positive environment. So some folks will go along the contraceptive. When the contraceptive pill is introduced, it was controversial for women's health and for women's rights. Now we are taking sex liberation to a new level, and it's important to make sure that we are seen to be looking after our sexual health and not wasting NHS money, which is how a lot of it can be portrayed. You equals you. So we're going to talk a little bit about, we've got PrEP. What is PEP? So PEP is an alternative medication that we have as available as well. There's two ways of looking at it. We have PR for pre, so PrEP being pre-exposure prophylaxis, and then P is for PEP, post-exposure prophylaxis. So PEP is available on the NHS, and it is a post-exposure medication that you can get if you have come into contact, or you believe you've come into contact with someone sexually who may be detectable. So if their viral count, if they are HIV positive and their viral count is not controlled by antiretroviral medication, then you may be able to get PEP at any A&E clinic or any sexual health clinic. So here's an example of when you would access PEP. So say, for example, on a Wednesday, you have sex with potential exposure. That could be without a condom, it could be condom breaking, could be a variety of reasons as to why that happens. You have 72-hour window to access PEP. So you could go into any A&E clinic, open 24 hours, and ask for PEP. They will provide that to you. It is most effective the sooner you take it. So like the morning after pill, the sooner you take it, the more likely it is, the better it is to have an effect on the system. And then you've got a course of PrEP lasts for 28 days. So like PrEP, it has a similar sort of medication within it, but it will do for after that exposure. But it needs to be done within those 72 hours. Greatly reduces the risk of infection by over 80%. We have these wonderful cards that we can hand out if folks are a little bit unsure about how to access PrEP. So we provide these in our clinics, we provide these in our centres and out in our outreach as well. So it just gives a bit of information about PrEP, and if someone is experiencing has experienced an exposure, they know exactly where to go and what to do. It also gives the user a bit of anonymity to be able to go to any clinic and hand that card over with the details, and the healthcare professional will know exactly what to do, and you don't have to have that conversation as in-depth in the reception area type of thing. So what is U equals U? U equals U is undetectable equals untransmittable. So someone who has HIV, is living with HIV, if they are taking their medication correctly, so their antiretrovirals, or ARTs as they're called, if they are taking those as stated, their viral count becomes so low that they cannot actually transfer the virus to anyone, regardless of protection. Now, we will always recommend using condoms and dental dams as a method of protection from all STIs and HIV, but this does greatly reduce the risk of transferring. So if you are undetectable with your viral load, then you are untransmittable, that you will not transmit the virus. This is great to go towards our goals of 0 new HIV cases. In the UK, we are working towards that. And with a combination of U equals U, people on their ART and people on PrEP not acquiring HIV, we can get that number to a really good level and get that as far down to 0, with 0 new cases being created. And yeah, that is the presentation as is. If you need support, we have a variety of different services at LGBT Foundation. We also have BHA, who have a variety of services available for Black, Asian and ethnic minoritized communities. If you are living with HIV, George House Trust are an absolute fantastic organisation to have peer support. They also have housing, they have drug and alcohol support, they have many different services available for those living with HIV. At LGBT Foundation, we have a variety of different services, including our one-to-one support, we have advice and signposting, and we also have local community events throughout all the boroughs in Greater Manchester. And we also have our free condom and lube distribution as well. So if you go to lgbt.foundation/condoms, you can order free condoms and lube and get that delivered straight to your door. Same with testing. We offer full STI and HIV screening. That can either be at our clinic in Fairburn House, just outside the Gay Village. We also have at-home testing where we can send out the kit to you. And that is all absolutely free. Then we've got, so if you want any further advice, we have our information. All of our information is based in lgbt.foundation. And that is the presentation as is. Do we have any questions in the chat? Do we have any questions in the anonymous form? Let's have a look. Okay, let's have a look at the chat. Thank you, Meg. I really do appreciate that. Butterfly socks. The clinics are really helpful and make it really easy. Thank you. Our services being free and accessible is probably the most important thing to us, to ensure that all LGBT folks have access to safe and accessible sexual health services. Is there an age limit? So with LGBT Foundation, we are commissioned for 18 plus. We will always signpost to anyone under 18 to local services to do the assessments there. But yes, the condom and lube distribution service is 16 plus. So anyone over the age of 16 can order our condoms and lubrication for free. And anyone 18 plus can come to our services for our sexual health testing. There are a lot of services available for specifically under 18s, such as Brook Healthcare, and their local clinics are definitely able to support better with the under 18s. What is the process of PrEP initiation? So PrEP initiation is the LGBT Foundation's set up for folks to get on PrEP. So, for example, this is the medication that you're given. I went and got my first PrEP initiation on Monday just gone. We run them every second Monday of the month. One at GAY, and then for further information on our second one, please go to lgbt.foundation/PrEP. But yes, we run these monthly, where you come to our venue and we get you signed up for the Northern Health Service. They will do a full sexual health screen. They will ask you information about your medical history to make sure that PrEP is suitable for you. They will also then do a renal health check. So they will take some bloods and check to see if you are suitable for, if your kidney function is suitable for going on PrEP. If all is well, the questions are answered well enough and the tests are done, you'll be provided with a 3-month supply of PrEP on the day, and then going forward you are reminded to make an appointment with the personal health record, PHR as it's called, and you can then get your repeat prescription through that. If you are not wanting to get on PrEP, you can still come along and get a full screening test done by ourselves. LGBT Foundation hosts this, so we are there on hand to answer any specific LGBT questions as well. Yeah, it's a really simple process. It takes about 20 minutes to half an hour. That's all the questions, that's the tests, that's the blood test, and getting your prescription as well. What else do we have? There are other options for getting on PrEP. So if you are not a member of the LGBTQ plus community, but you are part of the Black, Asian and ethnic minoritized community, you can sign up for BHA for Equality's fast track service. Meg, if you'd be able to pop the link in the chat for anyone, that would also be very helpful. Thank you very much. If not, if you go to bha.org.uk/PrEP, you can access the fast track service there. We also have a variety of different ways to do it through the Northern Health Service. You can request an appointment through there. It can be quite tricky because they have 2 slots, I believe 8:30 in the morning and 12:30 midday. Those are the only 2 times that you can book an appointment, so you have to be very quick and on the mark and be ready to log in. So we recommend attending one of the drop-in clinics because it means that you can get seen there and then. Amazing. Thank you so much for that, Meg. I really do appreciate it. I'm just going to quickly check the Ask Me Anything form to see if there's any anonymous questions that have come through. Okay, nothing there as of yet. But that is everything that we had to go through for today. Thank you so much for coming along. We really do appreciate you listening. This video will be available on our website and it will be available on our YouTube channel going forward, and we can support. If you need any extra support, please contact the links below and we should be able to get you to the right service for you. But thank you again and have a wonderful day.